Hello students. So today we are going to talk about the cardiac output topic. As I in previous video I talked about it, that cardiac output. So what is cardiac output? So cardiac output is a volume of blood which is pumped by each ventricle in a minute. I am again repeating, cardiac output is the amount of blood or a volume of blood which is pumped by each ventricle in a minute. In a minute. Okay. Now there is another term which is called a stroke volume. What is stroke volume? So stroke volume is the amount of blood or a volume of blood pumped by one ventricle per beat. Okay. Cardiac output per minute, stroke volume per beat. So stroke volume average value in a normal human being is 70 ml. So in each heartbeat, there is 70 ml of blood is pumped, which is called a stroke volume. And there is a normally 72 heartbeat per minute. So cardiac output can be calculated by multiplying stroke volume by heart rate, which is 72 heartbeat per minute. So if we are multiplying it, we come with the result 5040. Okay. So, because stroke volume unit is ml and heart rate is minute inverse, so our cardiac output unit is ml per minute. So, in a normal person, the cardiac output is 5 liter per minute. Okay. So, there is some more extra points, but before discussing it, let's do some interesting explanation of those points. Okay. So, assume there is a glass filled with water. This water is assume blood, and this glass assume is ventricle. Okay, so the amount of blood or amount of water in this case filled in a glass, total amount of water is called as, total amount of blood is called as EDV, called as end diastolic volume. So it is the amount of blood in a ventricle before its contraction, before ventricle systole or before ventricle contraction. So before contraction, the amount filled blood in the ventricle is called as EDV. So after the contraction, the amount of blood which is left out in the ventricles is called as ESV and systolic volume. Okay, so amount of blood which is pumped, we already discussed. This value is called as stroke volume. Okay, so from this to this and systolic volume, and the amount of blood which is pumped in a heartbeat is called as stroke volume. Okay, okay. So and diastolic volume and systolic volume definition is this. For a normal person, EDV is 120 ml and systolic volume is for a normal person 50 ml. So if we minus both this value, we can find out the stroke volume. Okay, the stroke volume, another definition is EDV minus ESV, and stroke volume can also be calculated by cardiac output by heart rate. These two way stroke volume can be calculated. Okay. Now, if I ask what is the heart efficiency? Heart is also like a machine, and every machine has some efficiency. As we already discussed here that not every amount of water, not full amount of water is pumped by the heart. Some amount of blood is left inside the ventricle even after the contraction. So its efficiency is not 100% means. So what is efficiency? Efficiency in a general term, definition of efficiency in a general term, as you already studied in physics, that Carnot engine efficiency. So it is input, total input in the denominator, and out of that input, what is the useful output? This is the general efficiency formula. Useful output by total input. What is your useful output for a heart? Stroke volume, which is pumped by it in a heartbeat, and its input is and diastolic volume. Okay, so ejection fraction is a heart efficiency, and its definition and its formula is stroke volume by and diastolic volume. Stroke volume can also be calculated by EdV minus ESV. So this formula can also be written by like this or like this. This equation is looking like a Carnot engine efficiency formula. Okay, so it is only the variables are changed, but efficiency formula is like this only. Useful output by total input. Okay, so in a normal person, the efficiency or ejection fraction EV is around 50 to 60%. Of course, for an athlete, it should be more than, or it can be more than. Okay, so let's do some numericals based on these topics. Okay, so we are going to do some numericals. Okay, so see here. Question 1. A medical student A medical student measures the following value for a person at rest. Okay, cardiac output this much, heart rate this much, and systolic volume this much. Calculate the stroke volume. Okay, so let's solve it. Solution 1. So stroke volume can be calculated by cardiac output by heart rate. So cardiac output is 5600 ml and heart rate is 80. Okay, so it is came 70 ml. Okay, now EdV and diastolic volume, and diastolic volume is equal to ESV plus SV and systolic volume plus stroke volume. So it is 50 given, and stroke volume we calculate 70. So and diastolic volume is 120 ml. And now in last they are saying calculate the ejection fraction. So EF. So EF is equal to stroke volume by EdV. Stroke volume is 70, it is 120, so it came 0.588, 0.583333. Okay, this. So in the percentage it came 58.33%. Hence solved. Okay, very simple question. Okay, let's do some tricky questions here. So let's do some tricky question. Solution 2. A person has the following cardiac parameters. Okay, EdV this much, ESV this much, 60 ml, heart rate is 70 beats per minute after consuming 3 cups of coffee. Okay, 3 cups of coffee, so yours, whatever coffee you're drinking, uh, it's stimulate the sympathetic nerve, and sympathetic nerve has an action on heart rate. Okay, it's increase the heart rate. Parasympathetic nerves decrease the heart rate. The sympathetic nerve system increase heart rate. Remember, increase heart rate, and parasympathetic nerve decrease heart rate. Okay, so after consuming 3 cups of coffee, heart rate increased by 40%, ESV decreased by 10 ml, and EDV and its diastolic volume remains unchanged. So let's solve it. So it's asking first calculates the initial stroke volume and cardiac output. So initial stroke volume SV initial I. So and diastolic volume is given 150, ESV is given 60. So it came 90 ml. This is initial stroke volume. Okay. Cardiac output initial is what? 70 is a heartbeat initial. Okay. And what is stroke volume? 90. Multiply it and it will came 6300 ml per minute. Okay. Now, after 3 cups of coffee, lots of coffee, strong coffee, its heart rate increases by 40%. So let's calculate heart rate. New heart rate initial is 70 plus 40%. 40 by 100 multiply by 70. Okay. 40% of 70 increases. So 70 plus 0.4 multiplied by 70. So it came around 98 beats per minute, BPM. It can write like this. Okay. Now, in the second question, in the second calculation, they are asking new stroke volume. So for calculating new stroke volume, uh, we should have cardiac output, but we don't know the cardiac output, but we can calculate stroke volume by stroke volume by EDV minus ESV. Already discussed, EDV is how much? 150, and ESV decreases by 10 ml means first it is 60, now it is become 50. Okay, new. This new ESV is 50. 10 ml is decreased now. So total stroke volume is came how much? 100. Okay, now you can calculate new cardiac output. Okay, just multiply heart rate. Heart rate is how much? 98. 98, and stroke volume is 100. So it came 9800 ml. Cardiac output is too much. Okay, so as you can see here, that's why coffee make you so much active, but that much amount of coffee is not good for health. Okay, because increase amount of cardiac output or heart rate will affect your kidney also. Okay, so this is the cardiac output. Okay, now in the last they are asking determine the percentage increase in cardiac output. Okay, so percentage increase in cardiac output. Okay, so percentage increase can be calculated 9800 minus what is the initial cardiac output 6300 by 6300 multiplied by 100. So if we calculate, it will came like 55.55%. Okay, so that much increase, 55.55% increase of cardiac output. Okay, let's do another question here. I will give you one homework also. Okay. Two people, A and B, both have the same cardiac output, 6 liter per minute. Okay. Person A and person B. Person A heart rate 60. Person B heart rate 100. Its EDV 160. Its EDV 120. EDV. Okay. Calculate the stroke volume of both individual. Okay. So we are going to calculate the stroke volume here. Okay. So how can we calculate? Heart rate is given, EDV is given. Okay. Cardiac output is given. Okay. So for stroke volume, cardiac output divided by heart rate. How much it will came? It is 6,000 here given, and heart rate is 60. So it will came 100 ml. For this guy, B guy, it is how much? Cardiac output same na? In the question given 6 liter per minute. Same for both. What is the heart rate? Heart rate is 100 here. What it will came? 60 ml. Now in the second, determine the ESV. Let's calculate and systolic volume. A. Diastolic volume is 160 given. Stroke volume is 700. So end systolic volume is 60 ml. ESV. Here it is end diastolic volume is given 120 and stroke volume is 60. So it came 60. As you can see here, 60 ml, same for both. Now in the in the third, it is asking ejection fraction, EF, for both. Let's calculate this also. Ejection fraction is stroke volume is 100 and diastolic volume is 160. Multiply by 100, percentage निकाल लीजिए. It will came 62.5%. Now second, it is 60 and diastolic volume is 120. It is 100. Ejection fraction is 50%. Now in last, they are asking which is more likely to be trained athlete. Okay, explain physiologically. So as you can see here, the ejection fraction more. Okay, stroke volume is high and heart rate is less. This point, this point, and this point. These 3 points suggest that person A is an athlete. Okay, why? Because lower heartbeat in a rest condition is called as bradycardia. When your heartbeat is 60 or less than 60. Because athlete heart condition is in very good condition, in their rest condition, uh, the amount of blood pumped by each ventricle is optimum. Okay, so their heart rate can be lower. Okay, because their EDV is higher, no? EDV is 160 ml here. So amount of blood filled in the ventricle is high, and because of that, stroke volume is also high. Okay, because ESV is constant. Here it is constant. For normal person also, and for athlete also, this should be constant. But if end diastolic volume is increased, automatically stroke volume is increased. And our body needs in the rest condition not that much amount of blood in a body. So for for decreasing the cardiac output, our heart rate will decrease automatically. For athlete person, heart rate will decrease because stroke volume is high for athlete person in a rest condition. So for decreasing the cardiac output in a rest condition, automatically heart rate will decrease. See here, cardiac output is stroke volume multiplied by heart rate. So for decreasing the stroke volume is high more in the rest condition. So if heart rate is also increase in a rest condition, cardiac output is more. Okay. So in the rest condition, cardiac output is not needed that much. Okay, because athlete is not running and all, na? It is resting. So heart rate is automatically decreased. So that cardiac output is almost constant. That's why it is given that cardiac output is 6 liter per minute. So for a normal person and athlete person, both have in the rest condition cardiac output is same, almost same. But their heart rate will have a difference. Like this, its heart rate is around 100 beats per minute. This condition is almost near to the tachycardia. Okay, this condition is tachycardia when heart rate is more than 100 beats per minute. Normal person like condition like this. Okay, or you if drink a strong coffee in the previous question, the condition is tachycardia. Now another question. Okay, be with me. Solution 4. A patient has the following heart parameters. Okay, its EDV is 180, its ESV is 90, its heart rate is 75. Okay, now a drug is administered. Because of that drug, its myocardial contractility means its ventricle contraction. Myocardial is muscle of myocardial contractility, muscle of heart. So due to that, drug, uh, its end systolic volume is decreases by 30%. Okay, so its EDV and heart rate remain unchanged, but its ESV is changed. So calculate the initial stroke volume and cardiac output, new ESV after drug action, new stroke volume, and determine the percentage increase. Okay, question is not completed here. Okay. Assume last question is how much the therapy is work here in this condition. Okay, because drug is administered. Okay, how much? Question 4 है how much the drug therapy is successful. Okay, now so stroke volume initial. So EDV is given 180, ESV is given 90. Okay, so it will come 90 ml. Same like cardiac output initial is 75 is heart rate and 90 ml stroke volume, it will come 6750 ml per minute, 6.75 liter per minute. After drug action, okay, its ESV new is decreases. तो minus sign आएगा, decreases 30% of its initial. So it will came around, calculate it कर लेना आप लोग 63 ml आएगा. Okay, now stroke volume will become, new stroke volume will become 180. Its EDB is same, in question it is given, minus 63. So it will came 117 ml. Okay. Now new ejection fraction will become 117 180. Okay, ejection fraction question is given. Okay, it's not given. Okay. Uh, okay, no problem. We can for calculating a drug therapy successful. For finding out, we have to calculate ejection fraction. Okay. So ejection fraction will become 117 by 180 into 100, 65%. Initially, how much it is? Initially, you can calculate here. Initially, it is okay. What is the stroke volume? 90 by 180, 50%. Okay, initial it is 50%. So if I increase the percentage increase in ejection fraction, so it is 65 minus 15 divided by 50 into 100. It will come around, I think, 30%. No? Okay. Yeah, 30%. So it will came around 30%. So as you can see here, the ejection fraction is increasing. So drug therapy is successful or it's working. Okay. Okay. So in last, this is the question, homework question for all you guys. Okay. So we will meet again. Thank you.